Hello, everyone. Welcome to a special edition of Coffee with Carriers. Today I have Janet Trautwein, CEO of NAHU, joining us today. Welcome, Janet.
Thank you, Becky. So nice to be here.
It's great to be sitting here with you. Can you believe in our careers, 36 years for me and
about 30
for you, that this is the first time we're sitting together to discuss anything? I can't believe that.
I know. We know of each other over the years and we've spoken with each other, but we've never been in person.
It's extra special after all this time. What I'm most excited about is for you to really share all the work that you've been doing on the Hill, but can you give us a little bit of background on the No Surprises Act, from compensation to all the elements of this act, this legislation, but from your perspective, what our brokers really need to understand?
Well, there's so many things in it that are important. And one of the things that you have to do is put it in context of what's going on right now. So in Washington, D.C., everything's about transparency. Part of recent regulations have had to do with hospital transparency, with health plan transparency. But what I have the most questions on, because we're an organization that's all about brokers, is the new rules about broker transparency. And it's not that brokers don't want to be transparent about how much money they make. It's just that this is a pretty complicated rule, and they're not quite sure how to comply with it. So I get so many questions about that.
Part of it is also in the complexity. There's compensation commissions. There's also bonuses. And you don't always know exactly what your bonus is going to be ahead of time, right? And so from the standpoint of disclosing, and I'm sure there's not a singular template or anything like that. So just can you give us an idea of how brokers are to comply and not be in fear of, the repercussions of this?
Well, the biggest problem is we don't have the final regulations yet. We have some early information. We have information about the individual market, which the vast majority of brokers only dabble in. Some people specialize in it, but most of the time they don't. And it's an issue for not knowing what to do because we don't have these final regulations. So theoretically, this all goes into effect on your first renewal that follows December 27th. And that's looming very quickly, as we know. Yet we don't know exactly what to do with it because the regulations, which would spell out exactly how to comply, are not out yet. So what happens in that kind of a situation is you look at what the basic language is and you try to comply in good faith. So relative to broker commissions, you can say, I make this level of commission on this particular product and I make this on something else. Usually it's fairly similar and usually your clients are surprised that you make so little, right? But with the bonuses, you actually don't know because you might be paid a bonus based on multiple different clients. You certainly wouldn't know for that particular clients how much it would be at the beginning of the year. It's very different than some of the reporting that we've done in the past where you're reporting at the end of the year, say with Form 5500. Well, what NAHU is doing is we are putting together a template for brokers to use. We're hopeful that all of our work on the template will be wasted time and that the regulation will come out on a timely basis and spell out exactly what needs to be done. But in the event that it doesn't, we're putting together this template for brokers to use relative to disclosing that compensation. Now, relative to the bonuses, I have no idea how that's going to work. And I have to tell you, with our conversations with the Department of Labor, I'm pretty sure that they're not sure how that is going to work either. So we've asked for a delay in that particular part of the regulation. Actually, we've asked for a delay for all of it. We think it's too quickly to comply with any of it. But we're really emphasizing that second part because that's particularly different. I've heard some people are suggesting that perhaps not knowing what you're going to make in a bonus, you could disclose the bonus formula. Of course, you'll have to have the bonus formula. A lot of times a broker doesn't know the exact formula that their bonus is calculated on. So it's going to be some work for the carriers too, to make sure that brokers have at least something in order to comply. But in looking at these types of things, normally the Department of Labor, when they're regulating other similar types of reporting and disclosures, they're going to look at a good faith effort. And if you've made a mistake, particularly in the early compliance years, they'll just try to help you come into compliance before giving out the penalties.
Yeah. You know, being in this industry and having gone through, small group reform and AB 1672 in the 90s, it comes out and it's guns blazing. And as the time gets closer and closer, certain parts fall off, certain things, and so I know there's a lot of angst in the market about this, and it's a pretty broad piece of legislation, right, that everyone is trying to understand. Is there any chance, and like how we saw with the ACA, things got pushed back further and further, and so you've asked for it to be pushed back, but do you guys feel that there's any chance that some of this falls off, some of this gets pushed back? Like, what's your feeling on this from a gut level and the conversations?
Well, I hate to try to predict, but I think there's maybe a 50-50 chance.
Wow.
That it could be delayed, the whole thing. I think there's a better than 50-50 chance that they could delay the part about the indirect compensation, which is the bonuses primarily. It does include other things, but that's primarily that. I will say, if we look at the Affordable Care Act, there are things that are in the Affordable Care Act that the Obama administration decided to delay regulating, and they've never been regulated on, partly because they were unworkable provisions. We think the indirect compensation is one of those, that it's an unworkable provision. So we're hoping that it just is delayed permanently. But we're going to be there and working on it. We work very closely with the regulators. So we're going to be working on it either way, just to make sure that we get the most positive outcome as possible.
There are good parts to this legislation, right? The transparency from the standpoint of hospitals and a consumer being able to understand, what the cost outlay is going to be, right? Like, can you, in your opinion, articulate some of the better parts of this legislation that brokers can really latch on to explain to their clients why this is happening and not have it be such a ominous thing that's going to happen?
Well, the whole idea behind the package of things that were included in the legislation, there was a purpose behind all of them that had to do with helping the consumer have more information in order to make better decisions. And the idea was the more information they had, the better decisions they could make, and that they would make them ahead of time. Now, I will say, and I hope that that's the outcome, and I will say though that it may not be entirely that, because sometimes when we make decisions about health care, we don't always make them based on price. You make them based on you're sick, or your children are sick, or your family is sick, and you make those decisions for reasons that have little to do with price. So in fact, some of the things that we've seen relative to other types of price disclosures, in the end, the consumer did go and look at the information, and they did the same thing that they were going to do to start with, maybe what their doctor had recommended. Now, having said that, we're all for transparency. For example, the hospital transparency is quite interesting, and some of the things that they're being asked to disclose could be quite helpful. We're finding, though, what's really interesting with the hospitals is a lot of them they're already supposed to be complying. They're not doing it. They're complying partly, or they'll disclose a few things, or maybe they will not disclose them in a format that's very usable to the consumer. So a lot of the hospitals are saying, look, I'll disclose some of this stuff, but I'm actively not going to disclose this, this, and this. And the reason I'm not going to do that is because paying the penalty is less expensive than me disclosing this. I'd rather pay the penalty. So the penalty is $300 a day per item, which sounds like a lot, but when you look at the difference, what their concern is, the biggest concern they have is if they're disclosing proprietary information from a number of different payers, they're concerned that whoever the payer is that got the best deal, that they'll end up having to give that deal to everyone. And right now they count on having a good risk spread among the payers so that they can, spread out their losses or maximize revenue. Some hospitals are worse about it than others, and then some of them are really struggling because they don't have, they're smaller facilities and they just don't have the ability to disclose the information like some of them do.
Okay, Janet, so now let's talk plan transparency.
Well, this is something that brokers may be thinking so much about their own broker compensation disclosure. I know a lot of them are also concerned about the rules that have to do with plan transparency. This is particularly relevant if you are working with self-funded clients, and I know probably a lot of the people that are listening today do work, at least some, with self-funded clients. There are numerous requirements, that have to be met relative to things that plans have to disclose. Everything from the statistics on certain illnesses to everything in the world about prescription drugs to many, many other things that have to do with, how far along people are with their deductible, which is a little bit more common already, but a lot more disclosure information than it's in the past. You'll be getting a lot more information on that. We've had a few small delays with that, but not too much really, so to speak. And I would encourage brokers that are going to be involved with self-funded clients in particular to make sure that you and the TPA that you use or the plan that you use, whoever's administering your claims, make sure that they understand all of the things that need to be disclosed.
As a general agent, right, and as an active participant in the healthcare ecospace, the brokers come to us, right, for guidance and for tools and whatever they need for their clients. And we want to be very proactive. We want to be somewhat aggressive, right? And so can you share like how we can be a resource even though there's so much that's not known? And I really do want you to cover what you believe is coming next, right? But we really want to be a resource for our brokers, whether it's the small groups or self-funding groups. And so how do you see us playing a role and to be able to support you?
First of all, I'd like to talk about what I see just from where I am, what your role is directly with the brokers that you serve. What a lot of people don't know about me is that I actually used to be a broker. And when I was a broker, there were not nearly as many rules as there are today. We didn't have it was before the Affordable Care Act. And there were a lot of rules that you had to keep up with, but not to the extent that there are today. Today's broker has to be not only someone to match them up with the right plan, but they also have to advise them on compliance issues, on so many different things that are much more complex. Even their compensation structure for their employees. How can they possibly keep up with it and still write enough business to make a decent living? How can they do that if they don't have someone like you? Frankly, I don't know. So I think that your role is critical in helping them do what they need to do to serve their clients. I can't thank you enough for what you do for them.
Well, likewise, we can't thank you for what you do on our behalf at the highest level. I refer to NAHU as the mothership, and we're little associations where we're looking for the signal from the mothership on how to be, again, that resource and to really support our brokers, because you're right, the job has become very complex, right? From not only wanting to provide the best value to the employers on when they're making decisions, but like you said, to be in compliance with all the rules and regulations that are out there. And so I appreciate you understanding that from our perspective, but for us at Amwins Connect, there's also this other special, very near and dear to my heart, is the employer and that small employer that needs the support from that broker, right? So if we can be organized and give the brokers what they need and have an understanding to pending legislation or things that are changing in the marketplace, how they also then can communicate that to their employer groups. But I want to take it one step further. I want there to be something where an employee truly does understand the benefits the employer is providing and how to actually use a health plan, right? And to not be afraid that if they use it, are they going to have to take out a loan? The high deductible health plans have become very prominent, and so it's hard for an employee to understand when maybe you've been used to an HMO and all of that. So I think collectively together, all of us, right, from NAHU, the association, to the general agents, to the brokers, if we continuously are dialoguing on things that are really important, and if we can create a forum to always be talking about this, right? We don't have to be in this separate situation. We can come together and really attack a lot of these issues that are facing our industry. But, coming back to what else? What else do you see is coming out that we may not know about?
Well, Congress is very busy right now. They're very busy working on a lot of kind of end of the fiscal year kind of things, and they're also busy working on some legislation that they very much want to pass before the end of the year under a reconciliation measure, which is a budgetary provision that allows the Senate to pass things more easily than it normally does, to kind of bypass some of the parliamentary procedures that otherwise would be. Well, what's important is a couple of things. First of all, they can only include certain types of measures in there, and they're only going to be able to afford a certain number of these. So what I'd like to do is mention to you the things that are on the block of things that they're considering putting in. And at the end of the day, they'll put some of them in, not all of them, because they won't have the money to put them all in. But they want to put them all in. So you should know that if they don't get them in here, those things are still on their list of I want to do that. So the first thing they want to do, and they will probably get this, is the tax credits that are in the individual market. And I know that Amwins works primarily in the group market, but some of
a lot of
your brokers probably at least have somebody in their office that does individual business. So the tax credits that were temporarily increased because of COVID-19, and they were increased mainly because the formula completely changed for how they were calculated, and they were available to more people. Well, all along, during the temporary measure, it was for 2 years. Well, they want to make them permanent, or at least extend that way beyond 2 years. So that'll be the number one thing that they're trying to do, and they'll get that.
The tax credits.
The tax credits will be permanent under the new formula, which is much more generous. So that means we've seen many more people qualify, and qualify at higher levels. The second thing they want to do has to do with states that did not expand Medicaid. Since they can't make the states expand Medicaid, they want to replace what that would have done. And so what they do is they look at that same population that would have been covered, and they're saying for the first 2 years, what we want to do is let them go in and get these same tax credits that the other people are doing. And then beyond that, we want to create this special program just for them, kind of like a public option, which is we could do a whole segment just talking about that. That's probably not a great idea. But the little known thing that's in there that is super important to everyone who has employer-sponsored coverage is that the normal firewall is taken away for this particular provision. And what I mean by the firewall is normally if an employee has an offer of affordable minimum value employer-sponsored coverage, they want to go and get coverage through the exchange instead, they can, but they won't be eligible for a tax credit.
Really?
Okay, so that's a firewall that's in there, and that's in there for an important reason, and that is to make sure that employees stay in their employer-sponsored coverage so as not to skew the pool effect. So in this particular provision relative to that Medicaid population, what this says is that rule about the offer of a valid employer offer, that goes away, that they can go get it regardless of even if they have an offer of employer coverage.
Sort of, so that there's more going towards the exchange?
Well, they just want to make sure it's affordable.
Okay.
Their concern is that the person may not be able to afford the cost sharing in their employer-sponsored plan. The deductibles might be too high for them, and these other programs have built-in ways to lower that down. But we have to be really careful about that. Really look at that cautiously and with a lot of skepticism as to whether that's a good idea to take away the firewall. Because taking away the firewall for them could mean that it's easier to lower that firewall in the rest of the employer-sponsored market, which would not be a good idea.
Right.
To be honest, I'm less worried about a population that would have been a Medicaid population, because frankly, in a state where, like California, for example, where there was a Medicaid expansion, they would have gone to Medicaid anyway.
Right.
We watch little nuances like that to make sure that they don't creep into other places. So we're watching that. And then another thing that's really important has to do with prescription drugs and making the cost of prescription drugs lower. This is super controversial. And they, of course, what they want to do is make the prescription drugs lower for everybody, not just in the Medicare program. Their actual authority to regulate is only in the Medicare program. But from Congress's perspective, in this bill that they're working on, if they passed a bill that said that they could also regulate the private market, then they could. And a lot of people think that's not such a bad idea to regulate drug market prices, because the cost of prescription drugs is really high.
Yeah.
But it's unlikely to get through politically under regular type of order. So I feel less like that will be in, but you can know that will come up over and over again, that trying to take a bite out of the cost of prescription drugs. And so that will be something we'll see. And then the last really important thing is they're looking at lowering the eligibility age on Medicare. And sometimes people looking at this say, well, why do we care about that? Well, it's all the things that go with it. Number one, how would they pay for it? Medicare is already on the brink of insolvency.
Right.
So how would they find the money for it? But there's the issue of the way it's written, they would allow people to opt out of their employer-sponsored plan in order to take it. Now, frankly, if you don't understand how pooling in insurance works, you might say, that sounds like a good idea. My people age 60 and over are my most expensive population, and maybe that'll be great to let them opt out. Well, here's the thing. You can't just set up something where only your age 60 can opt out.
Right.
They're not a permissible class under ERISA just by age, which could include all different sorts of job titles, right? So the people that would be likely to opt out, one 60-year-old is one 60-year-old. They're all different types. The 60-year-old that's likely to opt out and go into a Medicare program, which probably has lower levels of benefits than what their employer offers, will be your younger, the ones that are 60, 61, and triathlon participants. They won't be the ones that have health problems. Those people will stay in the employer plan and get the better networks and the better level of benefits that they receive there. So it could have a really detrimental effect. People don't think about this on employer-sponsored coverage for us to do something about that Medicare age, not to mention that we can't afford it. So I'm not sure if that will end up in there or not, but and there are some other things they're looking at that would be things that we would like reinsurance, which is a good market stabilizer, like telemedicine, which is great. Those things will probably make their way into this legislation they're looking at. And all of this will be done in the next couple of months.
So when I'm listening to you, right, like there's the legislation and then there's everything that everybody wants to add in little by little. And so let's talk about the creepers, right? And so as you get this creepage, what are the unintended consequences of a lot of this? And I know the bill's so large, but like if you're thinking from even the good stuff, right? Like it's not always the bad stuff, but some of the unintended consequences of this legislation and some of the things that are seeping into, what started out to be transparency and now is just mushroomed into a whole bunch of other factors. And you're right, we could probably do a segment on prescription drugs too, on philosophically speaking, but let's talk about some of these unintended consequences.
So if you try to make everything perfect for everyone, what happens is that you make it perfect for no one, or you make it maybe not even good for everyone. If you do things that cause the pools of covered people to become imbalanced, and you create adverse selection in any however you do it, many of these things could do that, then the cost of coverage will go up. And we always think about, well, we are all for private coverage in our country. That's what we are in favor of. But the biggest way to not have private coverage and to have a single payer system instead is for the private market to fail, for it to implode into itself, because we've tried to make it so perfect that we ruined it. And so that's what the creep does. We always watch for all of those little things that might just chip away, and we try to prevent those from happening. That's one of the main things we work on at NAHU.
Okay, Janet, so we've covered a lot in a short time frame, and this topic, again, is very near and dear to our brokerage community, to us as general agents. But if you could share with our broker audience today, what's the most important thing you want them to take away from this?
I guess I want them to pay attention and not think this is like everything else they've seen and that it'll just blow over and that someone will hand them a sheet of paper that says, 1, 2, 3, and this is what I do. The number one thing I want them to understand is a lot of these things that are happening right now are things that they need to talk to their clients about, particularly their employer clients. Some of the transparency directly affects employer clients. It's things that particularly their smaller employers may not realize that they have things that they will have to do now. When you talk about a plan that's self-funded, a self-funded plan is the employer. The employer is the plan sponsor.
Right.
The employer is the one that has to comply. It doesn't matter that they have 50 employees or 10. In some states, at 10, they can be self-funded. And that kind of an employer still has to comply with all of these things. So they need to look to their brokers for the right information, and the brokers need to know that they have the right information. So they can, get that from you and from us. At NAHU, we are a professional association for brokers, and that's what we do, and we advocate all of the time. Advocating, that's a big Washington word. That just means that we represent you before members of Congress, before the agencies, before all the policymakers, not just those people, by the way. We have to make sure that all the other organizations want to do the same thing we do as well. But anyway, they need to talk to their clients, and they need to be paying attention. And there's so much that could change. They need to watch for the little things and not just the big things.
Advocacy, it's a very important word, in our business. And you're fighting at the highest levels, right? To have the legislators understand the broker's universe, so to speak, and everything in it. And I think the broker has to be an advocate for that employer. And coming back to how you're saying, speak to them, make them a part of what is happening, and let them have an opportunity to understand. Right now, they don't need the entire legislation, but the things that pertain to them, bring them into the conversation. The advocacy from NAHU to Amwins Connect, general agencies, right? Like we're constantly advocates for our brokerage community, and for them to do the same for their employer groups, and the employer to be the advocate for the employee, right? The ultimate consumer of everything that's going on. So how can we support you? How can we, as an industry, support your efforts and everything that NAHU is doing?
Well, I have to say we're working really hard on everybody's behalf. And we're a membership organization. We're a professional association. So if you think that, your attorneys have an association that they belong to, and your physicians have an association, and people that work in the health insurance field are just as much professionals, and we are the professional association. So the number one thing they need to do is join. We are funded by dues, period. We're funded by dues. And that's what pays for everything that we do. We have to pay our employees. We have 30 people in our Washington office. We have to get all of those things done and keep the lights on, and all of the things that others have to do.
So be an active member of your local association.
Yes, and when you join your local, you also join your state. Your state is doing the same thing and paying for lobbyists at the state level. So local, state, and national goes together. And it's actually pretty inexpensive. I would imagine that most people think that it's some giant amount of money or that it's someone else's responsibility, but I probably spend more on coffee. It's really very, very affordable, but it makes such a huge difference. So we need them to do that. And then you need to, if you can be active at your local and state level and participate and help those chapters have good programming and so forth, and participate in the programming they present, that is hugely helpful. All of that pays for all of the state efforts, for example, that we do. What you can't do is just sit back and let someone else do it.
Right, right. So be an active member of the association, have a voice, and make it your association, right? That represents your needs and your constituents, so to speak, right from that employer population. Well, Janet, it's been really wonderful having you here, and I hope to do many more segments with you on
I do too.
on things that matter the most in our, like I say, I like to call it our ecosystem of the insurance companies, the brokers, the general agencies, and then of course, you know, the mothership that you represent, our association that's fighting on our behalf constantly. So thank you for everything you do, Janet, for us and our community.
Well, thank you for having me.
And thank you for joining us on this special edition of Coffee with Carriers. We look forward to bringing you more insightful videos, relevant topics facing our industry. So stay tuned till the next time.
Baby, yeah.